Hi, my name is Dr. Cary Gans, and I'm the president of the Long Island Group for Headache Management. In this brief hangout, and I don't know who's going to be listening, hopefully a bunch of you people, but in this brief hangout, I want to cover three things. I want to cover basically some of the frequently asked questions that I get at my practice here in Garden City. The first question, and right now the main topic we're going to cover is TMJ pain, temporomandibular joint pain. That's the hinge at your upper jaw, where your lower jaw hinges to your skull. The reason I want to talk about this initially is because many of the headaches we see every day are caused by an imbalance of the temporomandibular joint. We have to realize that our entire head is a process, and that process, both muscles, nerves, and bone, have to be in synchrony, have to be in balance. If they're not in balance, problems result. No different than in any other part of the body. The only reason this complex is different is that the temporomandibular joint is bilateral. It works on both sides of your jaw. Your arm is unilateral. Your knee is unilateral. So it's a far more complex situation. Plus the fact that most of us talk all day, we swallow 800 times a day, we eat. So the facial muscles and the jaw muscles are working constantly. So let's talk about the three questions that I get asked all the time. First question is, how do I know if I have TMJ? Because patients are always thinking because they can't do something or something bothers them, they have quote unquote TMJ. Well, TMJ is a specific problem. It's has specific symptoms. Now they do vary from individual to individual. Right now, if you look at yourself and you have pain in your jaw joints, pain in the muscles, limited opening of your jaw, you can't open your mouth wide, you have difficulty biting into a sandwich or difficulty chewing. If you have pain when you eat, not in your teeth but in your jaw, if you have ringing in your ears, called tinnitus, or sometimes even vertigo, dizziness, all of these can be symptoms of TMJ. TMJ, another name for TMJ, by the way, and temporomandibular joint dysfunction, is myofascial pain dysfunction syndrome. Because it's more of a muscle, myofascial means muscle, it's more of a muscle problem that relates to the joint itself. So all of those symptoms, as well as the associated headaches that occur with them. So we often see people with what they think are migraines, tension headaches, cluster headaches that are really a result of this total imbalance of the temporomandibular joint. So that's really, in a nutshell, some of the causes. Now, it can also be caused by accidents. It can be caused by grinding and clenching your teeth. The second question is, what causes it? Well, those are some. You can have an accident 10 years ago that threw this balance off. And because of this imbalance, now you have symptoms. You can also grind and clench your teeth. Many people do. You know, sometimes your spouse will tell you do it at night. Your coworker will tell you do it during the day. Sometimes it's just poor dentistry. A dentist puts in a filling. The filling is a little bit high. He says, go home, you'll adjust to it, or you think you will, even if he does, or even if he or she doesn't tell you that you need to. You're always better off, by the way, going back and getting it fixed. But you go home and you just shift your jaw very slightly to get rid of that prematurity, or you attempt to grind that prematurity away. Well, in doing so, the muscles that force your jaw to one side or the other are going to go into spasm. They're working harder. Muscles are meant to work and relax, work and relax. If they have to work harder for whatever reason, they're going to get sore. Sore muscles hurt. All right, so basically that's some of the symptoms. The causation, as I explained, can be something as simple as an automobile accident many years ago, bad dentistry, not bad dentistry, let's call it compromised dentistry, habits. Now, there is a certain percentage of the population that do have an arthritic jaw joint. You can have wear of the disc that separates your lower jaw and your upper jaw. That can be worn. The muscles up there can be torn. There are certain things that can happen, but those are relatively rare compared to the overwhelming part of the population that basically have an imbalance in the muscles due to habits, dental problems. That may not even be a dental filling. It may just be where your bite is. Some people have very steep overbites, very steep overbites. Some people have lost teeth, missing teeth, and have to function differently because of loss of teeth. This system has to be balanced. Now, the next question is, so the first question we get, what causes it? What are the symptoms? We've gone into that, right? Clicking, ringing in your ears, popping in the jaw joint, pain in the muscles, inability to open and close your mouth, can't bite into a sandwich, can't bite into a big sandwich, things of that nature. So those are the symptoms. The cause can be an accident, can be habits, can be something in the jaw joint itself, can just be something as simple as dental needs. You either have fillings or crowns or bridges that were placed and aren't functioning properly, or a lack of dentistry. And the third thing is, how do you treat this? That's the most important. Is it treatable? Well, many years ago, this was a difficult problem. Many years ago, there really were no diagnostic tools, and there also were very limited treatment tools. Diagnostically, we would go ahead and look at you. We'd listen to your jaw joint with a stethoscope, possibly take some x-rays called tomograms, and we'd look at your jaw joint and see if it looked relatively normal. If we heard popping or clicking, but you had no pain, you weren't treated. If you had popping and clicking and you had pain, we would most likely put you on some medication, maybe go ahead and put a mouth splint in, and at some point in time, maybe adjust your bite. That was it. But we had really very few diagnostic tools other than going by the symptoms that the patient presented with. Today, that's all different. Today, we now have a system that gives us real data, computerized data that shows us what the problem is. We now know who we can treat and who we can't treat. If you know who you can treat, you can get success rates that are very high because you can specify certain treatment modalities to those problems that exist and fix them. So we have great diagnostic tools today, and we also now have learned from sports and rehabilitation medicine how to treat sore muscles. They've come a long way in treating athletes. Why not use the technology they use to get those sore muscles healthy? So we now use the same non-invasive, FDA-approved, AMA-approved tools to go ahead and treat those sore muscles. That, with a combination of diagnostic tools and treatment tools that specify if we have to adjust the bite, we now have tools that tell us exactly what to do, rather than using the little blue and red paper that has been used for the last probably 100 years. We now have far more computerized technology to help us with that as well. So we've told you a little bit about what causes the symptoms. We've told you about what causes it. And we've told you that there is hope for those of you suffering with TMJ pain, chronic headaches. Now, not all headaches are caused by TMJ. Many of these headaches are caused by an imbalance in the muscles of your head and neck, going back to the neck muscles, up into your temporalis muscle, the masseter muscles, the sternocleidomastoid muscles. All these muscles have to work in unison, have to work bilaterally, and function as one system. Our goal is to help you with that. So if you have these problems, and you live here on Long Island, we're located in Garden City, right across from Roosevelt Field Mall. We're here early in the morning. We stay late at night. Lots of parking. We even have fresh cookies if you're hungry. So give us a call at 877-626-0969 or at 516-741-1230. And we'll be happy to get you in. We'll talk to you a little bit, see if there's something we can do to help you get rid of those pains. If you're having chronic headaches every day, every other day, if you're taking lots of pain medication, if you're wearing a mouth splint all the time, there is help for you. Please give us a call. Have a great and pain-free day.